Madam, tell us about cirrhosis.
Okay, so cirrhosis is a disease that occurs by degeneration and regeneration of liver tissue. A liver cell is destroyed, then replaced by fibrous tissue, giving the liver an orange-yellowish color and a cobbled appearance called hobnail liver. The damage is irreversible. Cirrhosis is twice as common in males as females. Research shows that cirrhosis is in 5% of livers in the USA, and it forms when the person abuses alcohol or results in an infection of hepatitis B or C. You can massage someone with cirrhosis, but do remember it's irreversible. Massage can help aid the liver while it's in this weak state. Since the liver does so much for the body, working with light pressure and informing your client that it may bruise is important since it's a sensitive area, and to also make sure that your client has consulted with their doctor before being massaged.
I like that. It's well said. Where's your liver located?
It's like up here, right?
Yep, upper right-hand side. Up underneath the ribs, a little bit pokes out below the ribs, so if somebody has really bad liver problems, it can actually protrude a little bit here. And they can be very sensitive right there. It'd be pretty bad by that point. But it can. The liver can kind of grow for bad reasons and kind of get shoved under there a little bit. So yeah, essentially cirrhosis usually comes from two different sources. One is getting hepatitis, which is a liver disease, and people often have a very yellow tone when they have hepatitis. That does not mean everybody that has a yellow tone has hepatitis, but honestly, it's one of the ways I diagnose it, you know. And usually you get hepatitis from sharing dirty needles and sex with people with hepatitis. However, you can also get it. My mother got hepatitis, and she claims, I don't know, she claims that she got it from the dentist. Actually, they really do think they got it from the dentist, that she had some dirty dental tools that got it. And she walked in the doctor and they said, gosh, you look awful yellow. And she had hepatitis. And that can cause liver damage too. But heavy drinking can cause liver damage too. And what happens is the liver cells actually get replaced with scar tissue. And what is scar tissue? It's connective tissue. So it's fibrous tissue. When this blogs to fibrous tissue, that's connective tissue. And so the liver starts to harden. And hold on, they're signaling me at the door. Please, come on in, buddy. Sorry, guys, hold on. So kind as to talk to us about constipation.
No, it's awful.
I love that you got this one. I don't know why.
The first thing I thought of when you told me I had to talk about constipation was that one really old episode of King of the Hill. Does anyone know what I'm talking about?
I know the show, but I don't know the episode about constipation.
Oh God, there's an episode where he's...
I'll look it up later, yeah.
It's just so funny, but anyways.
So what's constipation?
Yeah, it's, so constipation is when your bowel movements, like, become less frequent. And
yeah, when your fecal matter doesn't move through your intestines, right?
Yeah, like, you can't get it out.
Right. Can it,
and,
yeah, go on.
Usually because of a change in your diet, you don't have enough fiber, or you're not drinking enough water.
Fiber and water, yeah. You'd think fiber would make it worse, but in general, fiber and water make it better, yeah.
I read that your colon absorbs water.
That's what your large intestine does, yeah, especially.
Yeah, if you're constipated, your food moves too slowly through the digestive tract, so your colon has more time to absorb water and it dries out your poop.
Yeah, so guys, this is kind of interesting what she's telling us, if I can kind of elaborate. What she's saying is if you're dehydrated, your food's kind of dry going through the tubes of your body, right? But because it's going through so slowly, the large intestine has time to actually extract even more water from it because it's going so slowly, which makes it even more dehydrated. So you kind of create this vicious cycle where your dehydration makes the food not move well, but the food not moving well makes you pull more water out of the food, which makes you more dehydrated, like the food more dehydrated and not move through as well. So drink water. Yeah. Miss Petrie took a big chug right then. She's like, okay, just to make sure. Anything else, Miss Cooper?
No, that's about it.
Can you massage people with constipation?
Yeah.
Yeah.
Just, I guess, yeah.
If it's extreme constipation, they need to go to the hospital eventually. But
Maybe even massaging their glutes over the sheet would help.
their glutes or their abs?
No, their gluteus maximus.
Yeah, but actually your intestines, I hear where you're going. But your intestines are actually up in your tummy tum.
Okay.
Yeah. Yeah. Stomach's up pretty high actually, and all your fecal stuff and all your food is actually down in your tummy tum. Cool. All right. Thank you. So far, no contraindications with either one of these. Ms. Felix Osuna, what is Crohn's disease?
Crohn's disease is a type of inflammatory bowel disease that happens at the beginning of the large intestine and then at the end of the small intestine. So mostly happens in the youth years, so when you're like old, I suppose. You need to avoid massaging that area because it can cause them pain or make them uncomfortable. The symptoms of some symptoms are anemia, diarrhea, fatigue, and weight loss. Not many have symptoms, others have symptoms that can be chronic, and then they go away. That's about it.
So, in simple terms, what's Crohn's disease? Like, what's going on? I don't care even where, but somewhere in the intestines, what's happening?
It implements the beginning of the large intestine. So it basically makes them, I guess, uncomfortable when you eat or something like that. I'm not sure.
So, but I guess what I'm digging for right now is like, what's happening in the large intestine? I don't mean like chemical terms or something like that. Are they bleeding? Is there bacteria in there? Is it what's going on in there that's causing them the pain? What is happening? If I was a little kid, how would you explain to me what Crohn's disease is?
I'm not sure. Maybe they might have bleeding internal. I suppose.
Okay. My understanding of Crohn's disease is that actually people get small lesions, which are kind of bleeding inside they get some type of irritation from this disease. They don't know why. That causes irritation inside their bowel, and lesions, which are little cuts really inside, not cuts with a knife, but bleeding and stuff inside their bowel, and that's where the pain comes from. Miss Felix Osuna, what kind of contraindication is this?
I don't think it's. It probably is local.
It is a local contraindication. Thank you. That's exactly what I wanted to hear you say. So it's a local contraindication, so you avoid one area, and what's that area?
That's the abdomen area.
Yeah. People with Crohn's disease usually know they have Crohn's disease, and so you would not massage the abdominal area because it will cause them lots of pain because they don't just have gas in their intestines, right? This is not like a digestive little thing. They've really got some lesions inside their intestines, and it's really quite painful. There are some medications for it, but they still don't know what causes it. Cool. Anything else?
No, that's it.
Okay. Miss Hanson, as a follow-up to constipation, you got diarrhea. I mean, you don't have it. Well, maybe you do. I don't know. But you got it for your assignment.
So diarrhea is frequent passing of unformed loose watery stool. Diarrhea can be acute and last a few days, or it can be chronic and last a few weeks. Depending on the cause, diarrhea is considered a protective response. Acute especially acute cases, in an attempt to remove harmful ingested substances.
Yeah.
Common causes of diarrhea can it can be from liquid diet, food intolerance, stress, anxiety, or use of laxatives. If it's chronic, it's normally due from Crohn's disease, so I can't say that word. Psoriatic collectives,
I have no idea.
celiac disease, and IBS.
Got it.
If it's acute, wait 24 hours after the diarrhea has stopped to massage. In case it's chronic, well, avoid the lower abdominal area.
Yeah. So you just wouldn't want to stimulate the lower abdominal area, right? Because you might make them go to the bathroom.
Yeah.
Usually diarrhea is by the way, for one thing, I don't know how much detail I want to get into here, but for one thing, everybody's different. It depends on how much water intake. So if you are in a high liquid diet and you've got lots of water coming in, you'll have just diarrhea just because there's not a lot else going in there. But usually it's a protective measure. I know this is a very funny way to think about it, but just like when you throw up when something upsets your tummy, this is throwing up from your butt. It's your intestines saying there's something in here that I don't like, and it's trying to dump it out quickly. And that's a good thing. So it's trying to flush the system. And yes, it is often the sign of another problem, right? If you have it once or twice, it's not a sign of anything. But when it's regular, it's often the sign of some other thing like Crohn's disease or some other problem in there. So well said. Anything else that we need to talk about diarrhea? Do you feel like we kind of covered it there? Got it. And what kind of contraindication might it be?
Acute. Like, just avoid the abdominal.
So local?
Oh, local, yeah.
Yeah, local contraindication. Cool. Thank you. Yeah, and you're not going to kill anybody either way, right? It's going to be interesting. Okay, Miss Harper. Miss Harper, what are gallstones?
Gallstones, it is pieces of solid material that form in your gallbladder, a small organ under your liver. Gall stores in bile, a fluid made in our liver to help in digestion. So the bile also carries waters like cholesterol and bilirubin, which your body makes when it breaks down red blood cells. So these things, it can form gallstones. So this gallstone can range a size of a grain of sand to the golf ball, to the size of a golf ball. So you might not know that you have them until they block a bile duct, causing pain that needs treatment right away. So here in the US, gallstones are a common complaint. It also affects 10 to 15% of American adults. Doctors not sure exactly what causes gallstone, but they might happen when there's too much cholesterol in your bile. There's also too much bilirubin, the yellow things in your bile, and your gallbladder doesn't empty all the way. So the risk factor of gallstone is if you have family history, if you're a woman, if you are over age 40 years old, and if you are like Native American or you have a Mexican descent, if you are obese or you're using birth control pills, something like that. So in massage, if they have like pain in the abdominal area that is so severe, massage in that area is contraindicated. So if the client is not comfortable in prone position, you can do the side lying or the seated position so you can massage the back area. And then if the client already know that she has advanced gallstone, their shoulder pain, it will not be relieved by massage. So yeah, this condition should have like initial assessment with the massage therapist and develop treatment plan that reflects the special needs of the client.
Got it. So gallstones really are really tiny, tiny, tiny little stones that are made in your body and then can be quite painful later if they have to move through your body. So what type of contraindication is this?
Local contraindication.
It's a local contraindication, yeah. There's no real big fear for us with gallstones. The client might be, if it gets really bad, they're not even going to come see you because it's so painful. So, yeah, cool. Anything else, madam? I don't have any other questions.
No.
Okay. Ms. Hunter, gastroesophageal reflux disease.
Morning.
Good morning.
Yes, gastroesophageal reflux disease is also called GERD, and that's way easier for people.
GERD.
Okay. Well, it's also called GERD, yeah. It's caused by weak or impaired esophageal. Can I just say esophageal sphincter, which results in the backflow of stomach acid into the esophagus. The acid causes damage to the lining and can cause esophageal ulcers, obstructive scar tissue, and even cancer. It can be acid reflux or GERD. Can be brought on due to stress, carbonated beverages, fatty and fried foods, spicy foods, acidic foods, pregnancy, overeating, and smoking. So all the bad things, including pregnancy. I'm joking, but yeah, pregnancy. It could be pregnancy related, and I'm assuming that has to do with the baby sitting on your stomach.
It does. It has to do with the baby actually pushing the stomach up, really.
Oh yeah.
And then there's less volume there, and it's a lot easier for the acid to kind of pump out. Yeah. Mm-hmm. Good times.
Nice. Massage can help with this. They say though that there should not be any massage administered at least 2 to 3 hours after eating. So hopefully the client, he or she comes in without having to eat previously, because that could screw up the massage really. In some situations, the client may have difficulty lying down or may need to be bolstered, so to reduce the possibility of acid reflux during massage. Chair massage is a safe alternative, as well as elevating the upper body while the client is supine. There are quite a few massage techniques and even studies regarding acid GERD, like that helps expand the diaphragm or extension of the spine. That in the study, quite a few people stated that they feel much better and they haven't had episodes of GERD. So it's really fascinating. I guess I'm not as excited about this one though, because I experience acid reflux. Usually when I eat spicy food, which I don't stop doing. So, oh well.
Can't stop.
But yes, you can massage someone with GERD.
Yeah, so a couple questions. By the way, everybody has probably experienced this once in their life. It's that feeling when you're like, you've kind of burped up some stomach acid and it's come up from your stomach and it burns inside your throat and it's gross tasting. And I mean, yeah. People that get it a lot, it's dangerous because it can actually burn the inside of their throat and cause all sorts of problems. A lot. What kind of contraindication is this, Ms. Hunter? Because it's not a local contraindication. There's no place you can't rub. So what kind of and it's not an absolute contraindication or a general contraindication where you don't massage them. Do you know what we call that when it's just something you have to consider?
Considered contraindication. But I forgot the exact term, but it's basically where we're cautious.
Yeah, you're relatively right there.
Oh. I wasn't going to call it a contraindication at all.
Yeah. We call it by the way, you'd be fine. I would agree with that. You can make that argument easily. If it is, it's called a relative contraindication. Relative contraindications are basically every single client you've got. That's not the way they describe it, but it means that you take precautions. You consider this thing while you're massaging them. And so the precaution with this thing might be how they lay on the table, right? You consider that. So when somebody's pregnant, for example, to me that's a relative contraindication. It's not a big deal, but I do consider it in my massage. So you've got absolute or general, which is don't do it, local, which is don't do this area, and relative, which is think about it, consider it, allow it to adjust your massage, but you're not really avoiding any one area or anything like that. Yeah.
So do you think that with someone who actually says, well, yeah, so you think that sideline would work well? Because it says something about elevating the upper body, but we don't have massage tables to do that. I mean, we can bolster them, but anyway, we haven't learned how to like have them elevated and massage. I don't know.
So yeah, but yes, elevation, chair massage. I mean, if it's somebody who's like, this is a regular problem for me and I can't lay flat on my back, then you would get them up off their back.
Okay.
Hopefully you'd have a wedge. We don't have one here, but they make these nice foam wedges and you'd stick it underneath them. If not, hopefully you've got 7 pillows and you shove them under there. Or you get a chair, or you know, lots of stuff like that.
Dope.
Yep. Yeah. Dope. Yeah. Thank you, ma'am. Thank you. Mr. Kadaris, you're going to tell us about IBS, irritable bowel syndrome. Is that when your bowel is mad at you?
Yeah. So, IBS, also known as spastic colon, is a large intestine disorder, and it's chronic, so it's not something that you can really, there's treatment for it, there's medication, but it's not really, there's no cure. There's 200,000 cases a year in the U.S., and people can just manage it by usually changing their diet or lifestyle or stress. And it can cause the symptoms. They don't really know, I don't understand how it happens, but based on the symptoms, being abdominal pain, bloating, diarrhea, constipation, it's twice as likely to affect women than it is men, and it usually happens in your 20s or your 30s. And then for massage, I don't know, it's kind of interesting because I don't know if it's one of those, what'd you say for massage?
Relative?
Yeah, because I don't know, what I read was that you should wait until the symptoms have gone away for the client to schedule a massage, because yes, it can help with stress, it can help release gas or whatever, but it just says that you should wait until after your symptoms have gone down a little to get the massage. You're not on the table oh, I gotta get up.
Yeah, that's the real issue. It might be a local contraindication of avoiding the abdomen area, but again, it's just a relative consideration that this person may not be comfortable laying on the table. Mr. Kandaris was right to mention that irritable bowel syndrome, IBS, is also called spastic bowel, and that's the problem with it, is when your intestines get irritated, right? One of the things they try to do to protect themselves is to dump out their contents. And you've got peristalsis working in there, and it'll start to make you feel like you have to go to the bathroom or make you go to the bathroom when you don't want to. So clients with irritable bowel syndrome do things like, oh, I've got to get up right now. And when you hear a client say that, it's usually something like that. I don't question them. I'm like, okay. And they'll sometimes throw the sheet around them and they run out of the room. They're going to the bathroom usually. They've got something going on downstairs. So just to let you guys know, that actually happens during massage. And somebody's got irritable bowel, and they'll come back and be like, IBS, my IBS is really acting up. No consideration really in massage in the sense that you can keep massaging them. They just, when they have to go to the bathroom, they have to go to the bathroom. Yeah? Cool. All right, any questions about that? IBS? Yeah? No? Maybe? Okay. Miss Monreal, will you be so kind as to tell us about peptic ulcer disease? What's a peptic ulcer? Miss Monreal? Miss? Oh, there you are. Miss Monreal. Talk to me. What is, yes, what is peptic ulcer disease?
So basically, they're spores that will develop on the lining of either the stomach, the lower esophagus, or the small intestine.
Yeah.
And I didn't like the explanation in the book because it was hard to understand.
No, but I want you to put it in plain English for us.
Right. So
That's what this exercise is, yeah.
so they kind of think that, I mean, it's not like stress will just bring it on, but I think it's a complication. And then also like overuse of like ibuprofen or just a type of pain relievers that are going to irritate those linings. So yeah, basically.
So it's, this is what we think of when we think of ulcers, everybody. These are essentially stomach ulcers. They can go to the small intestine, which comes off the stomach. They can be up in your throat a little bit, which comes off the stomach the other direction. But essentially, these are stomach ulcers where the lining of your stomach, the mucus lining of your stomach, has been diminished for some reason, and the acid is actually irritating the lining of your stomach, maybe even causing it to bleed. And that would be a bleeding peptic ulcer. Any contraindication for this?
No, only like if they were having some type of like heartburn type sensation, and they said that you might want to put them like in a reclining position.
So again, kind of a relative contraindication kind of thing, it sounds like.
Okay.
No, I'm not trying to shut you down. I just meant it sounds like what you're telling me is like a relative contraindication, like you might take some steps to make them more comfortable.
Yeah.
But you would still essentially massage them the same way.
Mm-hmm.
I agree. Cool. All right. I know, not super exciting. So a peptic ulcer is what you think of when somebody says my ulcer. It's a stomach ulcer, essentially. And again, this is the acid in your stomach getting through the mucus lining of your stomach and starting to burn you. It's not pleasant, right? Okay. All right. Miss Nguyen, you're going to tell us about a different type of ulcer. It's ulcerative colitis. Yeah.
I want to ask you one thing. I can tell about the colitis for you, but I want to write because sometimes I talk and some you don't understand, people don't understand.
Sure.
So I can write for you.
Sure.
Quick.
Yeah. No, it is. It's helpful, I have to admit. I mean, I want you to talk too.
Probably open in the method I stand already.
Inflammation disease of the GI tract, yes. What part of the GI tract? Sorry, I didn't realize you had the whole thing here. Good. Okay. That's.
Not yet in the.
There's more?
More.
I don't know. I'm asking.
I'm sorry.
No, don't be sorry. You haven't done anything to be sorry about.
But sometimes in the people people thinking about food and something. But anyway, in the head, in the back part, in the virus inside, maybe that in the back in the colitis. So I don't know how to talk about.
So
that.
it could. So you're saying it could be created by a virus inside too? Is that what you said?
Yeah.
Yes. Yeah. So, what you wrote is great. So, Miss Nguyen?
Yeah.
So, what you wrote is actually awesome. Really is great. So, can you tell me, maybe just a couple of sentences, if you had to explain to me, and I just was an ordinary person, like, I'll explain to everybody what you wrote. What you wrote is great. But what is, just in a couple of sentences, what is ulcerative colitis? Just tell me.
I know for and I know about the colitis for and the IBD and the have is mucosa inside colon and rectum.
Okay. Yes, most common inside the colon and rectum. Yes.
Yeah, and so and the have in the sometimes in the you have pain and have tired and lot weight.
What happens inside my colon when this happens? What's going on?
I don't know what happened about that.
Okay.
I because in the sometimes in the people talking about the side in the head in the bread part inside and maybe in the sometimes you eat food with very sour.
Right. You're telling me what causes it, and I appreciate that. I'm saying what happens. Like, I don't even know what an ulcer is. Like, what I don't understand. So what's going on inside my colon? Like, why is it painful? What happens?
Because I don't know how to talk about that. Because in the same, I don't know how to talk.
That's okay.
I know about that, but maybe sometimes in the acid in the folic and a lot for inside and maybe I don't know how to talk.
It's okay. I'm just trying to challenge you, and not just you, by the way, Miss Nguyen. I'm trying to get many of you to shift towards actually describing things like I'm a 5-year-old, because if you can't explain it to a 5-year-old, we don't understand it. If I told a 5-year-old, I'm not picking on you, by the way, at all. This is great what you write, and I'm going to explain it in a second. But if I told a 5-year-old, ulcerative colitis is a chronic inflammatory disease of the gastrointestinal tract called inflammatory bowel disease. Crohn's disease and microscopic colitis are the other common versions of IBD. The large intestine is part of the GI tract, a series of hollow... 5-year-old will be like, what are you talking about? Ulcerative colitis is when something destroys the mucus lining, the little protective coat inside your intestines, and then it gets irritated in there, it gets inflamed and burny and can even bleed in there, and it's unpleasant, and this usually happens down low in your intestines. That's a very simple explanation, and I love those because I want us to walk away and be like, yeah, I actually understand what it is, because none of us understand the chemistry, right? Anyway, you are absolutely right. You did a great job. Great job. But make sure on these things, everybody, that you could kind of explain it simply. But Ms. Nguyen is right. Ms. Nguyen is right, and lots of information here. Essentially, this is an ulcer instead of in your stomach, which was the peptic ulcer. This is an ulcer in your bowels where for some reason, and Ms. Nguyen was right. You were starting to answer my question in the complicated manner. She's right. You might get a virus or a disease down there that destroys the mucus lining. You might have all sorts of other things that can cause problems down there, and then when the mucus lining is destroyed in your intestines, then it gets irritated, and then sometimes it kind of works its way up, believe it or not. That irritation does. So thank you. That was fantastic. Really, truly.
I am talking the English, but maybe nobody understand about that. I worry, and so.
No, I like what you did here. This is good. I just want everybody. I love all the like high scientific stuff. I want that from us, but I also want us to be able to be like, and what that means is that your bottom hurts. You know, I want something simple at the end too, right?
Yeah, and even the people do for massage, right? Even the people have fever and no massage for that.
Oh wait, you just said something really neat. Thank you, Mr. Yen. So you said, if the people have a fever from this, no massage?
Yeah.
Yes.
And some is the able area is in the have in the lane in the have pain. I don't know how to talk.
If they have pain?
No, with that, but in the some in the so I write that.
Okay. So everybody, I want to ask a question because Mr. Yen said, if they have a fever from this, It's an absolute contraindication. It's a general contraindication, and those mean the same thing. It's a do not massage. Is that true?
Well, I don't understand why they would have a fever.
Well, you might have a fever because the infection was so bad in your bowels that you're fighting that infection. And also, by the way, ulcerative colitis can be caused from your own immune system attacking your own colon. And so you could be fighting an infection or fighting yourself and then running a fever for that reason.
And the reason you would not want to do that is...
Well, I'm asking first if we agree with Miss Nguyen or if she's wrong. Putting her on the spot.
I'm called that.
No, I didn't say you were. I'm asking people, is it okay to massage this person when they have a fever or not?
No, cannot massage. You can't do massage because some people have fever and the meat inside very bad.
Okay, so I know your stance. I'm asking everybody else if they agree with you or not.
Yeah. Okay.
I don't think you can massage if someone has a fever.
So you agree with her?
Yeah.
Okay.
with that as well.
You agree with her too?
Yeah, I mean, we can't get touched if we have a fever from this COVID situation.
Well,
So,
And if you go into somewhere, you have a fever.
okay. So Miss Yanez, Miss Petrie, Miss Monreal, you agree with her too?
I disagree.
You disagree?
I agree, but I disagree.
Well, I got to know what to do. I got a client with a fever right now. Can I massage him or not?
I have an autoimmune issue, and I struggle with having fevers. Now, it's not anything that's contagious, and I have gotten massages before, even though I've had a fever. It actually has helped me feel better. But in that respect, how is somebody going to know whether it's because of an autoimmune issue or they might have something? So I would say just avoid it altogether. But if it were me and I knew that person and they had an autoimmune issue, I would be okay to massage them if it was due to their autoimmune.
You're so nice. Is it? Yeah. An angle? Yeah, but it doesn't matter. I mean, I can fix that. Okay, you guys would be awesome. Cool, thank you. That's great. Sorry, Miss Monreal. They're bringing furniture in here too. That was great. I also, by the way, I was laughing so hard too because it also sounds like you're talking from inside a glass of water.
On my vibrating machine.
Oh, that's it. Okay. I've got that on tape, by the way, that you just said that. Anyway, there's a lot of good jokes there I'm going to let go. And so let me weigh in on this. So, Miss Nguyen
Yes.
and Miss Petrie and Miss Yanez, you guys are absolutely right. We don't massage people with fevers. Miss Monreal, however, you're kind of right. So yes, you are, Miss Nguyen. I wanted to make the big point for the class. The general industry standard is you can massage somebody with a cold once they're running a fever. That's a systemic problem. Their entire body is affected, so it's a local indication of their entire body, so we can't do the massage, right? So it's really an absolute contraindication. Don't massage anybody with a fever because they're fighting off stuff already through their whole body. There's no place in the body that doesn't have a fever, so you've got to treat it that way. But, and I'm not trying to pull my foot back out of my mouth here, and I'm not trying to be extra nice to Miss Monreal, but Miss Monreal actually talks about something that's very true in the real world. So, you are technically never supposed to rub somebody who has a fever. Does that mean Mr. Tapscott has never given a massage to anybody ever without a fever? No. You've got a regular client. They come in just like Miss Monreal is saying. You know they're in good health. They're running a low fever. They've got this recurring thing that happens. It's non-contagious. And they want their feet rubbed or something minor. I do. I'm not worried about that. But I'm talking about a lot of knowns, just like Miss Monreal said. I know the person. We know why they're having a fever, and we're not doing something crazy to them like deep tissue over their whole body. Right? But the general rule of thumb, everybody, is fevers are absolute contraindications. General rule of thumb, absolute no-nos. Good job, Miss good job, everybody, by the way. Good job, Miss Nguyen. I like how you stuck to your guns, too. Yes, Miss Monreal, what?
As far as for the then, how do you want me to to put that as far as the colitis, whatever.
It would be absolute contraindication if they're running a fever.
Okay.
Yeah, because if you're gonna have a black and white answer, that Miss Nguyen gave us the correct black and white answer. You went gray with me. You always like going gray with me, which I love. Okay, Miss Petrie, will you tell us about viral hepatitis?
I think you already did.
You think I already did?
Yeah.
Well, yes, I got you, but still.
Okay. I'll talk about it, I guess.
Yeah, talk about it again. Nobody listens to me.
Okay, so viral hepatitis means inflammation of the liver.
Yeah.
The liver is a vital organ that possesses nutrients, filters the blood, and fights infections. When the liver is inflamed or damaged, its function can be affected. Heavy alcohol use, toxins, some medications, and medical conditions can cause hepatitis.
Yeah.
However, hepatitis is often caused by a virus. In the United States, the most common types of viral hepatitis are hepatitis A, hepatitis B, and hepatitis C.
Yeah.
So, this is interesting, I thought, though. The viral hepatitis is the most prevalent liver disease in the world and the 12th leading cause of death in the United States. According to the Centers for Disease Control's division of viral hepatitis, as many as 5.3 million people are living with this disease. I didn't know that.
Yeah, it's a lot of people.
Yeah. You want me to keep going?
No, stop right there for a second.
Okay.
So, by the way, if a client has hepatitis, you don't really have to worry about contracting hepatitis from them, everybody, just so you know. It requires fluid transmission, which means that you've got to get some of their blood in you, really, or some of their fluids in you. It'd be very hard to do if you were doing your massage right. So it's not something to worry about. Even if you had a cut on your finger and they had a cut on their body, it's unlikely because they've got pressure coming out, but you've got pressure coming out too. It really is from, not everybody, by the way, not everybody. There are lots of people with hepatitis that got it, like from a dentist, like my mom. But really it's often sexually transmitted or needle use transmitted. And the reason it's so prevalent is hepatitis, at least hepatitis C, I don't know if all of them, is 100 times more contagious than AIDS. And so needle users usually actually get hepatitis from somebody else before they get anything else from them because it's so darn contagious. And some forms are treatable, by the way. Hepatitis C can be treated, but anyway, anything else, madam?
I mean, I have other stuff. I don't know what you
Is it a local contraindication, absolute contraindication, relative contraindication, no contraindication, contraindication, indication? I made up those last ones.
Well, I mean, side effects can be, like signs and symptoms are related to fatigue, headache, and nausea are the most common complaints.
Yeah.
Massage may be able to help with this, so
Yeah.
I mean they can get massage,
Okay.
but as long as it's done with caution and avoid over treatments. The other thing is it has to be fever-free for 24 hours.
There you go. So that's the only problem. Is again, if they're running a fever,
Right.
we would say no because they're,
Treatment.
yeah. But you probably will work on clients who have hepatitis that you don't know have hepatitis. Like that.
Right.
It's a pretty
Right.
common disease that's
With
carried around.
rocking.
What?
The shaking of the body. Don't do any type of bear walks, really. They bruise.
Oh, because they bruise easily, because yes. Yes, if they tell you, you'd be more careful. Yeah. Okay, cool. Again, I guess I'd argue it's a relative contraindication, especially for Ms. Monreal, since I think you're taking notes on this. Okay, for our next 3 presentations, I want to make something very clear for Ms. Stanley, Ms. Torres, and Ms. Yanez. I'm not expecting to be impressed, and not because you 3 aren't impressive. What I meant was I'm trying to relieve some pressure on you. You're just reminding us where this stuff is located, and just so we don't leave this section not knowing some basic stuff about either the liver, gallbladder, small intestine, or large intestine, depending on which one you have. But so don't feel, if you're feeling pressure right now, like, oh my God, I'm supposed to find this amazing new stuff. You're just reviewing with us real quick. It's not a big deal. So Ms. Stanley, in that light, can you remind us what the liver is and what the gallbladder is and just roughly where they are and why we should care? Just some basic stuff.
Okay.
Thank you.
The liver is the largest organ in the body. It's like in the upper right, I guess I'd call it the trunk, kind of. The trunk. And what it kind of does is it detoxifies harmful chemicals. It can make proteins. It also stores nutrients, and it produces bile, which bile is green, and it can helps with fat digestion.
Yes, exactly. It helps break down fats. Fats are hard to break down. And where's the gallbladder located?
The gallbladder is located the inferior surface of the liver.
Everybody see this? The only thing is my gallbladder is not the size of my fist. It's much smaller, but I'm just trying to give you an idea. So here's what we're talking about. Cool. Thank you. You don't need to tell me anything else, but do you have anything else that you just have to share?
Yeah, I looked it up on, I was wondering if there was anything massage related with it.
No.
And there is. It's nothing bad.
I thought you were asking.
Massage can improve liver function, and it can also possibly help prevent gallstones from occurring.
Yeah. Do they know why?
I didn't see a reason why.
Okay. Most of that is associated with circulation. Again, blood is life, and increased blood circulation seems to help all of your organs and all that good stuff. I don't know about the gallstones, but I have heard that before too, Ms. Stanley. So cool. All right. So once again, massage is awesome. You're in the right place. Cool. Massage, by the way, helps every condition we've talked about so far by lowering stress, because almost all these conditions, IBS, all that stuff, are increased by stress. Almost all of them are stress related at some level. Okay, Ms. Torres. Ms. Torres, will you tell us about the small intestines?
So the small intestine is also known as the small bowel. It is between your stomach and your large intestine. It is about 20 feet long and 1 inch in diameter. It does most of the digestion and the absorption of the food or water, whatever you eat or drink. It is divided into 3 parts. It is I don't know how to say it.
Duodenum. It's a hard word.
And it is the most. It is the most generative organ in the whole body. So it generates every 7 days.
Regenerates, yes.
That's pretty cool. So new cells every 7 days. It has some circular folds inside them that attach to the finger-like projections called villi.
Yep.
And they help to absorb some of the food as well. So yeah, that's what I have.
Cool. That's perfect. Okay. And Ms. Yanez, what's the large intestine?
The large intestine is also known as the colon or the large bowel, and it connects from your small intestine all the way down. Its primary function is to absorb water and electrolytes. It also produces vitamins like K and B, and it eliminates waste from leftover food as well as getting rid of bacteria. This process is known as peristalsis, and that can take up to 36 hours.
Cool. So that could be a long time. Thank you. That's it. That's perfect. That's exactly what I wanted. Awesome. Okay. So And I hope you like the nice diagrams as we did that. So you kind of remember what I want you to remember what this stuff is in the body. That's why we're doing all that. Thank you, Ms. Stanley, Ms. Torres, and Ms. Yanes, too. I always feel bad when I kind of give vague assignments, but I really just wanted to review that. So thank you. That was fantastic. Any questions? Want to use this first to try to explain to you about another system of the body. And then I'll go over all the stuff I say, get out of the way. I'll explain. You know, you could probably do a screen print too, you know that? If you hold down your Windows button and the top button up there that says print screen on your computer, yeah, it'll take a picture of your entire screen. Just saying. All right, I want to talk to you about the cardiovascular system. Cool? Can somebody tell me what the word cardio means? And don't say sweat into the oldies.
Heart?
Heart. Thank you. Cardio means heart. And what does vascular mean?
I don't know, like the tubes that pumps the blood?
Yeah, the heart pumps the blood, but the tubes that carry the blood, yes. Veins and arteries, vascular. Absolutely. Cool. So, the cardiovascular system is a system of a pump and a whole bunch of tubes filled with blood. Period, though. Why do I need a pump and a whole bunch of tubes going essentially, not even essentially, really to every single place in my body? Why do I need a pump that pumps blood through a whole bunch of tubes to and from every place in my body?
Because blood is life.
Blood is life. That's true. And in this case, what's the blood doing?
Supplying, I want to say like supplying oxygen.
It is. To who? To who?
To the cells.
Thank you. The cardiovascular, everything in your body is a... I'm sorry, what? Who, what? Somebody say something besides Miss Monreal? I thought I heard somebody. Okay. The cardiovascular system, which is the heart, vein, and artery system, supplies blood to and from all the cells of your body. All the cells of your body, cells are the most basic unit of life. And let me ask you some questions. Miss Nguyen, do cells make up your skin?
Yep.
Yes. Miss Harper, do cells make up your muscles?
Yes.
Yes. Miss Stanley, do cells make up your tendons?
Yes.
Yes. Miss Yanes, do cells make up your eyeballs?
Yes.
Miss Petrie, do cells make up every single thing in your body? Yes. Miss Felique Sasuna, what is the most basic unit of life? Something that can actually eat and pee and poop, essentially, not really, but can eat, pee, poop, and reproduce. What is the most essential unit of life?
Cells?
Cells. Right. Cells are called the most essential unit of life and make up your entire body because they actually eat, make stuff, reproduce, and get rid of waste. And by the way, newsflash, all of you eat, make stuff, reproduce, and get rid of waste. You're very, very similar to a cell. You are just a big collection of cells. And so when you eat, you're actually eating for your cells. When you go to the bathroom, you're actually going to the bathroom for your cells. So, When a cell is hungry in my big toe, can it go over to the refrigerator and get some food?
Scientifically, yes.
Because I can go to the refrigerator, is that what you're saying, sir?
No, I mean, I was just thinking, like, if that part of your body was hungry and it, like, I thought of the analogy of, like, muscle atrophy. Like, if you work out and you don't eat, you're, basically, if you have, like, gains from the past and you don't eat right, then your body's going to take from that muscle. Like, it's going to take from, you know, the proteins that are already there, and it's basically, in the long run, it's not good, and you will start to atrophy. So, I guess if that you're saying is like a cell, I don't know. I was just trying to think of something.
That was actually a fantastic answer, but way too intelligent for what I was asking. And I really mean that. I meant, like, you brought up all sorts of very true, very interesting facts. But on a simple level, when my cell is hungry, can it walk, my cell in my big toe, when it's hungry and needs food, because cells need food, can it go to the refrigerator and get food?
No.
No. When it has to go to the bathroom, can it get up out of my big toe and go over and use the toilet? No. No. So what happens is I have to bring the food, cells, basically most of the cells in your body, except in your bloodstream actually, and your lymphatic system, most of the cells in your body don't move around, right? My nose cells stay in my nose. My heart cells stay in my heart. I hope they do. My liver cells stay in my liver. That's what they do. They don't go other places. So I have to bring the food and bathroom facilities to them. Every one of them. Right? They're all invalids in that sense. They're stuck where they are. I have to bring the food to my cells. What brings the food to my cells?
So cells are like big.
Cells are like babies? Is that what you said? The stars?
Yeah.
Yeah, cells are like babies. That's a really good way to put it. They need to be fed, and they go to the bathroom, but they can't go do it themselves, right? So a whole bunch of them got together and made you to do it for them. The cardiovascular system is the system of tubes that brings food to your cells and takes their waste away. The cardiovascular system is the system in your body that gets food, nutrients, oxygen to your cells and takes away carbon dioxide and waste from your cells. It is the food system and in some ways the sewage system for your body in some ways. Otherwise, those areas of your body that don't get circulation die. And very simply put, your heart is a pump. We're about to learn about it. And it pumps blood to every cell of my body and then pumps back old dirty blood from every cell of my body and does it over and over again. By the way, on the way it passes by my lungs so it can get rid of CO2 and breathe in new oxygen. It passes by my intestines to pick up food for everybody and take it to them. But that's what it does. It also transports hormones around your whole body so it can talk to every cell. Yeah? Cool. So, let's talk about the heart. The heart is about the size of your fist. And it's an incredibly powerful pump that starts pumping before you are born and stops pumping at close to the time of your death. It never rests. The average person with this tiny pump. By the way, while I'm saying this, you can start doing this. See how you feel at the end of this lecture. Because your heart's doing this all the time. Unless you're running, and then it's doing this. Maybe if you're sleeping, it's doing this. Already getting tired, aren't you? And it's squeezing hard. It's got to squeeze blood around. It actually pumps, depending on your size, 1,500 to 2,000 gallons of blood a day. Yeah, thank you, Ms. Cooper. That's the reaction I wanted. That's a lot. Think about a gallon of milk. Think about 2,000 of those, and you are pumping them, right? This little pump does it. So let's talk about how it does it, because remember the 5-year-old thing? I want you to understand this like a 5-year-old first, before the book throws all these fancy names at you and everything, because at the end of the day, the heart is a pump. It's hooked to tubing that goes to your lungs to kind of pick up oxygen, get rid of bad stuff, carbon dioxide, and then it goes to every cell of your body to feed it, and then pick back up whatever the cells don't want and get rid of it. It's just a big circulatory pump. That's all it is. And your veins and arteries are just tubes. They might be really fancy tubes, they might do really cool stuff, but they're tubes. This is a pump, and this is tubing. Period. And that's not a lie. That's the truth. Like I might be oversimplifying it, but that's what it is. Cool. So, do we see this big green heart-shaped thing here? I hope. Good. Thank you. Thank you, Ms. Petrie. Obviously, your heart doesn't really look like a heart, but it looks a little bit like a heart, which is why I drew this, and it kind of helps to make a nice diagram. It'll help you remember. Okay. I divided this beautiful green heart into 4 sections. Do we see that? So, that's because your heart is a 4-chambered pump. It has 4 mini pumps that work together. These top 2 little, by the way, if this helps you, I appreciate your taking notes, and please keep doing that if that's what you want to do. But I'm going to go back over all this in the slideshow again. This is kind of the overview of everything. However, I do admit, if you capture all this, you've kind of got the whole lecture. But I'm going to go back over all this the way the book would go over it. This is the way Tapscott would go over it here, because I think this gives you a better overall view. So however you want to approach that, but I just want to point out, whatever I'm telling you now, I'm probably going to tell you again in the slideshow in a different way. So you should hear this twice. You've got a 4-chambered pump. This is actually a very efficient way to make a pump. One of the biggest problems with pumps is if you don't fully load them with new material, when they don't pump out very much because they're not fully loaded. And so this pump does that. It's got a fully loading system. I'm going to explain that. The top part, hold on one second, sorry. I just want to flip to something here. Good. Sorry, everybody. Bear with me. Okay. So, the top 2 pumps on your heart are called the atrium. You've got a right atrium and a left atrium. The bottom 2 pumps on the heart are called ventricles. You've got a right ventricle and a left ventricle. By the way, notice how these are flipped. That's because we talk about everything in terms of the patient, the client. This is my right atrium and right ventricle over here. This is my left atrium and left ventricle over here. That's why it looks flipped on the board, because it's for the client. Does that make sense? Good, okay. So you've got these atriums up here. These are chambers, they're pumps. And you've got ventricles down here. These are chambers, these are pumps. The atrium are priming pumps. What do I mean by that? Well, I thought this might be Mr. Ibarra.
That usually means you're getting ready for something.
Yeah, that's exactly right. Great answer. Thank you. The right atrium, its job is to pump blood into the right ventricle to get the right ventricle ready for a really big pump. The left atrium's job is to pump blood into the left ventricle to get it ready for a really big pump. So these are the mini pumps on top that fill up the big pumps on the bottom before the big pumps really go to work. So the ones on top are called priming pumps. I mean, that's what I call them. There is such a thing as priming pumps. I don't know about in your body, but that's this guy's job. This guy's job, the atrium on top, is to receive blood, pump it down in the ventricle, get it very, very full, and then the ventricle pumps again and pushes that blood out. Yeah? Yeah. Okay, good. So far, we're trying to build this up slowly. So far, we've got right atrium, right ventricle, left ventricle, right? Right atrium pumps down into the right ventricle, so it fills up, and then the right ventricle can pump to spit a lot of blood out. Left atrium pumps to get blood down into the left ventricle, fill it up, so when the left ventricle pumps, it spits a lot of blood out. Let's talk about where it spits that blood out too in just a second here. All right? But so far you've learned 4 things. Right atrium, right ventricle, left ventricle. Those are good things to know. Those are big heart facts to know. All right. Here's how it works. You have veins and arteries. Veins are tubing that is carrying stuff to the heart, and arteries are tubing that is carrying stuff away from the heart. Always. So, Miss Hanson, veins carry stuff where?
To the heart.
Thank you. And Miss Hanson, arteries carry stuff what?
Away from the heart.
Okay. Good. Thank you, thank you, thank you. Miss Bilotic, veins carry stuff where?
To the heart.
Yes. So Miss Bilotic, I've got these 2 things going towards the heart here. What are they called? Veins or arteries?
To the heart. We just went over this. I was listening, but then I'm like, oh.
You just answered the last question right. What do veins do?
Veins go away from the heart. No. To the heart.
Yes, veins go to the heart. So, Miss Bilotic, I've got these 2 tubes going to the heart. What are they called? Veins or arteries?
I just said it. Oh my goodness. I'm so sorry.
Don't be sorry. It's fun. So, what goes to the heart?
Veins.
Okay.
And arteries go out.
Yes, so veins go to the heart. So I've got these 2 things going to the heart. What are they called?
Oh, a vein.
Yes! Thank you. Cool. Awesome.
I'm sorry.
Don't be sorry, and thank you for letting me laugh at you. It's fun. It's okay. I do remember, and I hope you guys all know that I know this. It's one thing to know something. It's another thing to have somebody call on you in front of a group of people and ask you to figure out what they're asking for, right? I expect this to be stressful, weird, you know. And you guys don't know if I'm asking a very complicated question or a very simple one. I get the whole thing. You did great, Miss Bilotti. All right. These are veins. Now, these veins have fancy names, okay? Because these 2 veins are bringing blood from the body. This is called the superior vena cava, and this is called the inferior vena cava. And they are bringing blood back from every single cell in your body to your heart. So all these veins, and it's just like the nervous system, okay? There was these tiny little tubes that grew up into bigger tubes that came into bigger tubes. Eventually, all the tubes from your lower body enter into the inferior vena cava. All the tubes from your upper body go into the superior vena cava, and they all go into the right atrium. All of the blood coming back from your entire body goes into the inferior or superior vena cava and goes into the right atrium of your heart. Now, is this blood going to be full of nutrients right now or depleted of nutrients right now? Is this blood going to be full of oxygen right now or full of carbon dioxide right now? Anybody? Thoughts? Yes, Miss Hanson. No, go ahead, Miss Jonas. I just saw Miss Hanson reach and I thought she was reaching to say. Anyway, go ahead, Miss Jonas.
They say depleted because it's going back to the heart, so it means it already went where it's supposed to.
Thank you. That's exactly the kind of thinking I want. This is blood that's been used. It's on the way back, right? This is the empty tray you bring back to the counter, right? This stuff is full of CO2, carbon dioxide, and it's full of waste. And CO2 is waste for you. Trees love CO2, plants love CO2, but you don't. You can die from too much CO2 in you. And where's the CO2 coming from? Not from you guys, from your cells. So this is blood returning to the heart after it's visited all the cells, right? It's coming back through a vein. These veins at the end have very fancy names, but it came back through a whole bunch of veins, into bigger and bigger veins, and finally into the inferior vena cava and superior vena cava. And then it all went into the right atrium. And the right atrium is going to pump that into the right ventricle to fill the right ventricle up with this blood and make sure the right ventricle is ready for a really big pump. It's going to head
So-
Go ahead.
So if, with wearing the mask then, is your heart having to work harder then because it wants to get rid of the CO2, but then you're kind of breathing more in, so are you actually making your heart work harder to have to filter it again?
Yeah, you probably are actually. There's little doubt that masks help you retain some CO2. And they do make it harder to breathe. And if it's harder to breathe, your heart tends to start pumping harder to try to compensate. So yeah, you're right, Ms. Monreal. You're right.
Okay.
It definitely, and people in the medical field say it's a trade-off, right? You're trying to stop the virus, but you're making your heart work a little harder. Yeah.
Okay.
Yes. By the way, my girlfriend works for the VA, for the Veterans Hospital.
Uh-huh.
And she would agree with you, by the way. She says it's harder, but she says people have no idea. She has to wear an N95 mask with a regular mask over the top of it and a shield and in a full gown. And she's like, if she can breathe, she's like, the rest of you guys can breathe with your little paper mask on. But yes, but she would agree with you. It does make it harder. Yeah, and she says it's a lot harder when you have the really heavy duty masks on. And by the way, that's why when you hold your breath, your heartbeat actually goes up, because it's like something's going on here. We need more oxygen. We need to get rid of more CO2, and it actually increases. Our heartbeat does. Okay, so by the way, if you get all this, you will understand how the cardiovascular system works by the time I'm done. You may not understand all the fancy words, but you'll understand. Okay. So, Miss Hunter, I have a question for you. If you can hear me.
Yes.
Cool. Miss Hunter, all of the blood from my body comes back to the heart and goes where? Into what chamber of my heart? What chamber does all the blood go back into my heart?
The right. I I don't know what the A stands for.
That's all right. Thank you. The right atrium.
Atrium, thank you.
Good. And that was exactly the answer I wanted. Thank you. And Miss Hunter, since you did so well at that, the right atrium then pumps that blood down into the
Right ventricle.
beautiful. Awesome. Thank you, ma'am. Okay, so all the wasted blood, as Miss Giannis told us, it's dirty, it's wasted, it's full of CO2. It's probably, by the way, extremely dark red at this point because blood turns red when it touches oxygen. When it's depleted of oxygen, it gets dark red. It looks blue. It looks purple, but it's actually very dark red. Blood gets very bright red when it's exposed to oxygen, which is why you guys all think blood is red, because every time you see it, it's outside your body and it's exposed to oxygen. This blood is not bright red. It's coming back, it's depleted, all that kind of stuff. Yeah? Okay. So, all that stuff comes in here, gets pumped into the right, comes to the right atrium pumps into the right ventricle. It comes out the right ventricle, and it comes out these tubes that are going away from the heart. So, Miss Bolotic, there are these tubes going away from the heart. What are these tubes called?
Arteries?
Yes! She nailed it. They're tubes, and they're going away from the heart, and so of course they're called arteries. Yes.
I was thinking, like, this is how I pictured it. I know this might sound dumb.
No.
But I was thinking, like, arteries and, like, out. I don't know how I pictured it that way, but, like...
No. So artery sounds kind of out.
Yeah. Get arteries? I don't know, this sounds dumb, but that's kind of how I was thinking about it.
Miss Bolotic, that is dumb, and we'll probably all remember it because it's dumb, so thank you. And I don't mean that as an insult, I mean that as a compliment. The reason I try to act so weird in class is because you remember stuff that's weird. So arteries and outeries, we're now going to think about them as outeries and arteries. You've just probably helped the entire class, so thank you.
Can I take it up a notch?
Yeah! Take it up a notch, Miss Monreal.
Okay, well, one, I was originally thinking A for artery, A away. But then, of course, having children and having the mind that I have, fart, you want the fart away from you.
Okay, so
maybe that'll help somebody.
right, so speaking of stupid ways to remember things, Miss Monreal put artery with fartery. And you want farts away from you. So, and again, that was a compliment. Both of you, thank you. That's actually how you teach yourself stuff. Okay, so
we got
I'm sorry, what, sir?
I was gonna say we got outeries, and then for veins we got veins.
Oh, I like that.
Hey, that's good.
Veins, because they are spelled V-E-I-N. Veins. Veins. Okay. So we got veins, and we got artery, outery, farteries here. Okay, good. So, it's going to be a good day. All right, so all the waste from my body came in here, boom, right? It was deprived of CO2. It gets pumped down from the right atrium into the right ventricle. It comes out these artery, outery, farteries, and it's got to go somewhere to get rid of this CO2 and pick up more oxygen. Where do I go to get rid of CO2 and pick up more oxygen?
Lungs?
Lungs. This is the right pulmonary artery. This is the left pulmonary artery because I have two lungs and they're going off to the lungs. Now they will divide up into smaller arteries and all that kind of stuff, and they'll kind of get into tiny little capillaries and they'll stick onto my lungs and they'll let go of all their CO2 into the air, where a tree will pick it up and say thank you, because trees actually do the opposite, and then it will pick up new oxygen and leave the lungs again. Right? So coming back from the lungs through these tubes that are going back to the heart, or back in to the heart, vein ends. This is the left pulmonary vein and the right pulmonary vein, and they're going to go into the left atrium. They're coming back. They're full of oxygen. They're happy. They got lots of O2 in them. O2 in them. And they're happy. And they're going to fill up the left atrium. And when the left atrium pumps, where do you suppose that blood's going to go?
I hear a cricket chirping.
Yes, you do.
I don't think we know.
When the left atrium pumps, where do you suppose the blood's going to go?
Left ventricle?
Yes, left ventricle. Thank you very much.
11.
Thank you very much, Ms. Torres, too. Left ventricle. So now we've got this oxygen-rich blood. It got pumped from the left atrium to the left ventricle. The left ventricle is primed, right? This is the big part of your heart. Your heart's not quite even. And the reason they kind of show it a little bit more on one side is because actually it's in the center of your heart, in the center of your body, but the left ventricle is a little bit bigger. And the left ventricle is going to pump it out through these tubes. And by the way, those tubes are going away from the heart. So what are those tubes called?
Artery.
Yeah, artery away, arteries. Yes, arteries. And where do you suppose these tubes are going to go to? They're now full of oxygen-rich blood. They're happy. Where are they going?
Just to your body, right?
Yes, thank you, Ms. Yanes, and that's exactly the answer I wanted. I didn't want some fancy thing like, well, they go back to your body to go feed all the cells. This is the ascending aorta. This is the descending aorta. And by the way, none of this stuff looks this way, but it's a nice diagram. I think it's a great diagram, by the way. But anyway, ascending aorta, which essentially goes to your upper body, and descending aorta, which essentially goes to your lower body. And then they break down into smaller arteries and smaller arteries and smaller arteries until they get to these little things called capillaries. And then they go feed every little cell. And then the debris and the CO2 from the cells goes back into capillaries, into small veins, into bigger veins, into bigger veins, into bigger veins, until it goes into the inferior vena cava, the superior vena cava, back into the right atrium, pumps into the right ventricle, goes out the left pulmonary artery and the right pulmonary artery to the lungs, dumps off its CO2, fills up with beautiful new O2, comes back from the right pulmonary vein and the left pulmonary vein, back into the left atrium, pumps into the left ventricle, pumps out through the ascending aorta and the descending aorta into arteries, down to smaller arteries, down to smaller arteries, down to little capillaries to feed all the cells in the upper body, all the cells in the lower body. And then after they get rid of all that oxygen, little capillaries fill up with all that stuff and go into veins, and then go into bigger veins, and go into bigger veins, and eventually get into the inferior vena cava, the superior vena cava, and go back in the right atrium.
And touchdown!
Yay! So it's a big circulating pump. It's a big circulating pump. And just to be clear, just so we can kind of visualize this, let's take this artery and show you kind of what happens. Let's take this artery here. This artery has to eventually feed every cell in my lower body, right? So what's it going to do? Just like a tree, it's going to branch off. What's this branch going to do? Just like a tree, it's going to branch off. What's this branch going to do? Just like a tree, it's going to branch off. That's going to branch off, and that's going to branch off. Pretty soon the branches get very tiny. And then down here, you get these tiny little branches, and these are called capillaries. They're microscopic. Your little cells, believe it or not, are all around here, everywhere. And these capillaries are so small that they actually leak out the oxygen and the cells pick it up. And then the cells get rid of their CO2 and stuff, and guess what happens? Tiny little capillaries are there. Gotta pick that up. There's all my cells too. It's all happening right there. These capillaries go back. They join together in a vein. That vein connects back in to a bigger vein. And that bigger vein connects back into a bigger vein. And eventually it all gets back to the inferior vena cava and comes back to the heart. Yeah? That makes sense? Kind of, sort of, maybe? A little bit? Okay? All right. So, let's go around and ask questions about that. Please, I will be trying to help you with these questions. They are not meant to put you on the spot. They are meant to help us retain this information, right? Okay. Miss Nguyen. Hi. I always like to pick on you first just because it's the most fun. No, you're at the top of my screen right now. That's why. Miss Nguyen.
Yeah.
One word. What is the heart? What is it?
What?
What is the heart? What is it?
The heart, the have the
It does one thing. What does it do? What is it? One thing.
and bring blood in the all the whole body.
Yes! By the way, that was even a better answer than I wanted. Yes, it brings blood to the whole body. But what does it do?
I don't know how to say that. And the heat, and the I don't know.
Yeah, actually it does. By the way, I love what you're about to say. She's about to say it contracts, and it does contract, everybody. It contracts, and that creates a pump. It's a pump.
Yeah.
Beautiful. Beautiful. Fantastic. The heart is a pump. It's a pump made out of muscle, made out of cardiac muscle from the muscular system. Muscles can only do one thing, contract, and that's what it does. And it pumps out blood when it does that. Cool. Miss Harper? Miss Harper, what are arteries?
Arteries?
Yes.
It's the
Very simply put.
it's like I don't know if it is correct. It's like blood going away from the heart.
Sure. So, and the blood is going away in what little?
Little.
So, what's actually very difficult about these questions is they probably have a lot of answers, but they're little tubes, little hoses, little straws, little tunnels, something, right? And they carry blood away from the heart. Does that make sense?
Yeah.
Arteries are the tubing. They are the hose. They are the straws. They are the tunnels that carry blood away from the heart. Cool. Miss Stanley, what are veins?
Veins, they're like, how I think of them, they're just tubes they're like little means of transportation for blood.
Yeah, they're tubes. They're pipes.
Yeah.
They're pipes, people. They're pipes, they're tubes, they're straws, they're hoses. They're stuff that carries stuff back to the heart. Thank you. Carries liquids back to the heart. But they're plumbing. This is your plumbing system. That's why when you cut one, stuff spurts out. Just like when you break a pipe at your house, stuff spurts out. Same thing. Cool. Miss Yanez. Miss Yanez, what is the heart?
A giant pump for your body.
Thank you. How many chambers does this pump have?
4.
Awesome. What are arteries?
They carry blood away from the heart.
Yes, and what are they? What do you mean they carry it like in little buckets?
Like tubes.
Cool, they're tubes or hoses or whatever that carry blood away from the heart. And what are veins?
They're tubes that carry blood to the heart.
Thank you. That was fantastic. Miss Petrie. What is the heart?
The heart is pumping blood to the body.
Well, that's what it does. So it's a pump, right? Pump that pumps blood to the body? Okay. What are arteries?
Arteries are tubes that travel away from the body.
Yes.
Or with the heart.
They carry stuff away from it. Cool. And what are veins?
Veins are tubes that carry blood to the heart.
Yeah, well said. Cool. How many chambers does the heart have?
4.
Cool. What is the upper right one called?
The right atrium.
Yeah. What's the lower right one called?
Right ventricle.
Yeah. What's the upper left one called?
Left atrium.
What's the lower?
Left ventricle.
Thank you. If the right atrium pumps, where does it pump blood to?
The right ventricle.
Yeah. If the left atrium pumps, where does it pump blood to?
The left ventricle.
Yeah. Okay. New piece of information, everybody. Miss Petrie is 100% correct. This doesn't change the flow of things, but your heart, you know how it goes lub-dub? It's got like 2 beats, boom, boom. The 2 atriums pump at the same time, and the 2 ventricles pump at the same time. So it doesn't change anything, but these both pump. Both the right atrium fills up the right ventricle, and the left atrium fills up the left ventricle at the same time. It makes sense. The thing's a big muscle, and so it goes whoosh, whoosh. Atrium, atrium, ventricle, ventricle. Atrium, atrium, ventricle, ventricle. Both atriums pump. Both ventricles pump at a different time. But atriums, ventricles, atriums, ventricles. Lub-dub, 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 lub-dub.
But how do you explain somebody who has an irregular heartbeat?
Well, that's totally different subject. I mean, I realize it's about the heart, but that means that the timing mechanism for the lub-dub has got something messed up about it. Now, by the way, lots of people...
There's a double beat too, like some people have.
Or my father skips every 7th beat. Right? Now, my father's like 86 years old. Skipping every 7th beat does not kill you. A lot of people go, lub-dub, 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 lub-dub. That's his rhythm. But there are all sorts of problems with heart rhythms, which is why people have pacemakers and things like that to keep their heart from beating too fast, too slow, or things of that nature, absolutely. But that has more to do with the nervous system telling the heart to beat. And actually, it even has to do with the heart itself, because the heart kind of beats on its own. These muscles know they have to beat, and they kind of get in a rhythm, and they just do it. And the upper beating actually feeds the lower beating. They talk to each other. Yeah. But anyway, I guess my real point, Ms. Petrie, is you're absolutely right, but that's a big subject. There's lots of reasons why the heart doesn't beat normally. Lots of reasons. We're trying to work with a functioning heart right now. Cool.
I just didn't know if it had anything to do with this.
Lub-dub thing, yeah. I mean, it probably does, ultimately, but let's lay the foundation first. Miss Felix Osuna.
Yes.
The superior vena cava and the inferior vena cava are bringing blood from where to where? They're coming from where and they're going to where?
They're coming from CO2.
They're filled with CO2, but they're coming from where? Where's the blood coming from? That's going into
The veins.
What?
The veins?
You are right about that. And where's the blood from those veins coming from?
The body.
Yes, thank you. So this is all the blood from the body returning back in through the inferior vena cava and the superior vena cava. Yeah. By the way, Miss Felix Osuna,
Yes.
you've got a superior and an inferior vena cava. Which one's on top?
The superior one is on top.
Thank you so much. And the inferior one's on the bottom, because that's what those words mean. Yeah.
Yes.
Cool. And by the way, everybody, essentially the superior vena cava is getting all the blood from your upper body, and the inferior vena cava is collecting all the blood from your lower body. It's the last tubes going in. But remember, there's thousands of tubes coming into those big veins. Cool. And Ms. Fleek, when it gets into the right atrium, and the right atrium pumps, where does that blood go to then?
To the right ventricle?
Yes. And when the right ventricle pumps, where does that blood go to?
To the lungs.
Yeah. And when it gets rid of its CO2 and picks up new O2, where does it go?
To the left atrium.
Yes, you were exactly right. When the left atrium pumps, it's going to go where?
Left ventricle.
Yes, and when the left ventricle pumps, it's going to go back out to
The upper body.
the body, all of it. Cool. Thank you. Thank you. Miss Cooper. Miss Cooper, what is the heart? I'm 5 years old. I want to know what a heart is. Will you tell me, please, Auntie
The
Cooper?
heart is a big chamber.
What's a chamber?
A
What's a thing? What does it do? I don't understand. Why don't you tell me?
You sound like my brother. Alright. It pumps blood and nutrients out into the body.
Oh, it goes like this? And it pumps blood
Yeah,
out?
it goes like that, and then when it goes like that, all the blood and the nutrients go in and out of your body so that you don't die.
Okay, I understand now. What's an artery?
Arteries are what take the stuff out.
Oh, they're like those straws that go out of the heart?
Yeah, they're tubes. They're like bendy straws.
Well, then what's a vein?
Veins bring all the good blood and stuff in.
So they're coming back from the body with all the blood like a little through a straw?
Yes.
And they go to the heart, and the heart goes pumpy, 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 and then they go out through an artery?
A+.
Oh, I understand now. Thank you. Now I actually understand what a heart is. I appreciate that. Thank you. Awesome.
I got
Cool.
you.
Okay, you got me. Good. Okay, let's add a few more things. Now I'm going to add words to this, which kind of stinks. But there's valves in here and all sorts of stuff in here, and I just want to throw them at you again. I'm going to go back through them in my slide presentation. But you might as well hear them once now because I think repetition helps. Okay? So, the only way a pump works, by the way, is stuff has to come in through a hole here. This hole has to close off, and a hole underneath has to open up before it pumps to squeeze it to the next place. Right? The reason your water bottle works is you open up a hole and you squeeze it and it shoots out. If you want it to shoot out a different direction, you have to close up that hole and open up a different hole. So pumps always have a hole on one side and a hole on the other side. This hole opens up, stuff fills up the pump, this hole closes, the pump pumps, this hole in the bottom opens up and pumps it down somewhere else. Those are called valves. Your heart has valves. Your body has valves. Your car has valves. Your pipes have valves. Right? So, when blood comes, I just want you to have a rudimentary understanding of this. When blood comes in here from the superior vena cava and the inferior vena cava, your heart then closes this off. It opens up what's called the atrial ventricular valve, a valve between these two things. This atrial ventricular valve, which just means the valve between the atrium and the ventricular, right? They have to make it sound confusing so that people like me have jobs, right? So thank you very much. The atrial ventricular valve, this particular one is called a tricuspid valve because it's got 3 flaps. It's just important to know. This opens up and blood rushes out into here. And then this closes up and your body opens up. These valves down here that are called semilunar valves because they're shaped like a half circle, like half the moon, semilunar valves. This one is going to the lungs. The word for lungs is pulmonary, so these are called pulmonary ventricular valves between the lungs and the ventricle, and it goes pumping out there. So there's all these valves and there's all these confusing names for them. Right? Don't overthink it. Here's the confusing part. The valve between the atrium and the ventricle is called the atrial ventricular valve. That makes sense. They just put atrium and ventricular together. But that wasn't enough for them. They had to give it a more specific name, which is the tricuspid valve. So both of these are atrial ventricular valves because they're going from atrium to ventricles, but this valve and this valve are different. They've got different names. This is a tricuspid valve, and this is a bicuspid valve. It only has 2 flaps, or a mitral valve. They're just names. They're just names. But it's annoying. So, any valve between an atrium and a ventricle is called an atrial ventricular valve. That's what this one's called too. But then they're like, hey, this one's got 3 teeth on this side, 3 flaps. So we're going to call it a tricuspid valve. This one only has 2 for some reason. We're going to call it a bicuspid valve. And by the way, this one looks a little bit like a bishop's hat, like a church bishop's hat, which is why we're going to call it a mitral. A mitral valve looks like a bishop. It means bishop's hat. It looks that shape. That's how it got that name. It's like all the weird stuff in the body. It just got that name. Right? Personally, I think it's extremely important to understand there's valves between all these places because that's how pumps work. But the names, in my opinion, if you're not a heart surgeon, don't matter at all. However, they're common anatomy knowledge. It is common anatomy knowledge to know that the heart is a 4-chambered pump, that it has 2 atriums at the top, 2 ventricles at the bottom, that there is a tricuspid valve on this side and a bicuspid valve on this side, which is also called the mitral valve, between the atrium and the ventricles. That is common knowledge. It is common knowledge that there are semilunar valves leading out from the ventricles. The pulmonary semilunar valve going out to the lungs, and the the semilunar valve, which is called the articular valve, that's going out to the arteries. I hope I said that right. I mean, I know I said all that right, by the way. I was thinking about the articular valve. Yeah. Okay. So that was a whole bunch of fancy valve names. And that's it. Easy peasy, right? So, Miss Monreal.
Yeah,
Miss Monreal, what is the heart?
it is an organ that pumps blood to the cells well. Pumps blood throughout our body, which takes oxygen to our cells.
That's beautiful. How many chambers does it have?
4.
Yes, 4. What are their names?
Right to left. Ventricle, and then right and left aorta, or something with an A.
Yeah, atrium. Atrium. Atrium.
Yeah.
Yes, atrium. Which chambers are on top?
Atrium. Sorry.
Atrium is on top. Which are on the bottom?
The right and left atrium.
Yes, which are on the bottom?
The right and left ventricle.
Yes. What are arteries?
Tubes that take blood away from the heart.
Thank you so much. What are veins?
Tubes that take blood back to the heart.
Yeah. When they come back to the heart, when the veins come back to the heart, into the inferior and superior vena cava eventually, what chamber do they go into? Coming back from the body, oxygen depleted, full of carbon dioxide, coming through the inferior and superior vena cava, which chamber do they come back to the heart, returning from the rest of the body?
I know you talked about this, and I'm totally just gonna guess. But, so, the left, what was the A word? No? Wait, I don't know, I was looking at your hand.
Good. This is not my left hand.
Okay, so, opposite, okay, right. So the
Because
right
it's my side. Oh,
Yep.
right atrium. And then when the right atrium pumps, where does that blood go?
I'm gonna take two guesses. One to the body, or I don't remember like what the lung.
Can you see me right now?
Huh?
Can you see me right now?
Well, now I can.
All right, so when the right atrium pumps, where does the blood go?
Does it go to the right ventricle?
Yeah! When the right ventricle
Okay.
pumps, where does the blood go?
When the right ventricle pumps, where will I don't know, man.
Sure? You can't see me, I think.
I can kind of see you here and there. It switches from screens. Now I can see you. You're holding your both hands up. So does it go to the left?
I'm gonna come back to you. I think you're driving right now, right?
Yes.
I'm gonna come back to you. Miss Torres. Miss Torres?
Yes.
Okay, Miss Torres, when blood comes back from my cells, it's coming back through tubes that are called what?
Veins.
Veins.
I mean arteries. Sorry.
No. Let's go back to veins.
Well.
They're going towards the heart. They're coming
Okay,
back from my cells. They're going towards the heart. They're called what?
Yeah, it's the heart.
And what are they called?
Veins.
Veins. All those veins from my upper body go to the superior vena cava. From my lower body go in the inferior vena cava. And they go into what chamber of my heart?
Right atrium.
Yes. When the right atrium pumps, that blood goes where?
Right ventricle.
Yes. When that right ventricle pumps, all that blood goes where?
Your lungs.
Yes. It gets rid of the CO2, picks up new oxygen, comes back and goes where?
To the left and atrium.
Yes. When the left atrium pumps, it goes where?
To the left ventricle.
Yes. When the left ventricle pumps, it goes where?
Your body.
Yeah. Thank you. Awesome. Okay, everybody. That was good. That was good. Okay. Let's do something here.